So, what is hypnosis? A classic definition of hypnosis is defined as three elements. The first thing is absorption, the second thing is concentration, and the third thing is suggestibility. But it's not written on a stone. There are so many other definitions of hypnosis, and sometimes the definition of hypnosis is very controversial. But for the sake of simplicity in this presentation, we choose this kind of definition for hypnosis. A state of consciousness which is consisted of three items: absorption, concentration, and suggestibility. Dr. Milton Erickson is the father of modern clinical hypnosis. He was a psychiatrist in Wisconsin, and he has a lot of publications. Maybe the most famous one is Uncommon Therapies. Mechanism of hypnosis. Like the definition of hypnosis, the mechanism of hypnosis is controversial as well. There are tons of different mechanisms proposed, but personally, what I really like is the definition or the explanation of hypnosis based on the metacognition game. What's the metacognition and what's the metacognition game? When you feel a pain like a pinprick in your finger, it's a simple cognition. You feel pain. But this is not the most common cognition we experience as a human being. Some cognitions are really sophisticated because the signals goes up, they are analyzed in limbic system, and a very complicated and sophisticated cognition is made. These sophisticated cognitions are called metacognition. A simple definition of metacognition is a cognition about cognition. So metacognitions are high-level cognitions. And hypnosis is about playing a game with these metacognitions. And the reference for this definition is the Journal of Mind-Body Regulation. And this journal is published by University of Calgary. So are all patients or all clients hypnotizable? Based on American Society of Clinical Hypnosis, most of hypnotherapists believe that it's a trait. So it's like your hair color, your body size. So it doesn't change a lot during the lifetime. But sometimes the hypnotizability or the ability to be hypnotized can be masked by some conditions and circumstances like depression or psychosis. But when the medication is started and the depression is gone, then the patient jumps back to the previous state of hypnotizability. fMRI or functional MRI has provided us a great opportunity to watch the effect of hypnosis on the brain. So this publication talks about the facilitation effect of hypnosis on motor imagery. Actually, hypnosis is a great modality when it comes to neurologically impaired patients, like CVA or patients after cerebrovascular accidents or strokes. Personally, I have had some great experiences with the rehabilitation of people with hypnosis after stroke. Yeah, this is the affiliation of this study, and the result is published in the Behavioral Brain Research magazine, journal, sorry. And there are three basic hypnotic methods. The first one is the use of imagination. For example, a patient who is suffering from ulcerative colitis can imagine a tunnel with red walls. and then we can work with the patient to modify this imagination. In this approach, hypnosis is very similar to NLP, or neuro-linguistic programming. There are some similarities, but there are different entities, but they are very compatible to each other. The second method of hypnosis is to present ideas to the client. When the patients or when the clients are hypnotized, they are very susceptible to suggestions, or very receptive to suggestions. And we can use the suggestions for our therapeutic approach. So in hypnosis, we have different phases. The first phase is induction. The second phase is deepening. Through different techniques, we make the depth of hypnosis as much as possible, or as much as we need. And the third phase is suggestions. And this is the most important therapeutic phase. And the third hypnotic method is exploring the unconscious. It's not widely used in dentistry, but in psychotherapy and cognition therapy, it's a great approach. The first thing we should keep in mind when it comes to hypnosis is like other therapeutic modalities. We shouldn't exaggerate that, and we shouldn't underestimate that. So there are some strengths, and there are some restrictions when it comes to hypnosis. Pain control, which is really important in hypnodontics. And at the same time, it's not cost effective, because it takes something like 2 hours to induce pain in a subject. But most of the times we have easier ways, like lidocaine injection, to induce analgesia. This publication is about pain, and the way they measure the pain is they have measured the intensify matched stimuli in 3 groups of patients, and they realized that hypnosis can have a very interesting effect on pain control. This is the affiliation of the publication. And one of the most important indications of hypnodontics is bruxism and the temporomandibular joint dysfunction. As you know better than me, bruxism is widely associated with anxiety disorders, and temporomandibular joint dysfunction can quite occasion happens. So hypnosis can widely used to manage bruxism and to prevent from TMJ dysfunctions, and TMJ dysfunctions with other underlying causes can even be managed with hypnosis. Yeah, another association with temporomandibular joint dysfunction is tension headaches, and hypnosis can do a great job in terms of managing the temporomandibular joint dysfunction problems and tension headaches as a result of that. As you have experienced it, you know that sometimes gag reflex is really disturbing, and sometimes it stops the process. So hypersensitive gag reflex is a very good indication of hypnosis when it comes to dentistry as a hypnodontics. Yeah, gagging can be a chronic problem when it comes to dentures. And bleeding control. Bleeding control is one of the most important indications of hypnodontics, and it's more applicable to operative hypnodontics. Hypnodontics in dentistry, which is one of the most important indications, because children are more anxious when it comes to dental procedures. And one of the most important forms of hypnosis is Ericksonian hypnosis, or conversational hypnosis, or covert hypnosis. So the reason I have put Mr. Obama's picture here is he is really famous for using covert hypnosis techniques like truism or pacing and leading and body language mirroring to influence the audience. And these conversational techniques can be used widely in your office. The reason being is they are simple, they are so organic, and sometimes at the first touch, it provides you the opportunity to make your uh, patient calm. Hypnodontics in chronic pains, which is a really important indication, and hypnosis in hypnodontics when it comes to behavioral changes. Sometimes you need a behavioral change, like promoting flossing, and you can use hypnosis to promote these healthy behaviors. And the psychological interventions in hypnodontics, which is sometimes inevitable. And some techniques which are widely used in hypnodontics are let's pretend game, which is a kind of conversational hypnosis technique, and fantasy or hallucination of tongue thrusting, which is really interesting. We dive deeper if you're interested in hypnodontics later on. So let's talk a little bit about the hypnosis phenomenon. One of the most interesting and common hypnosis phenomena is catalepsy. Catalepsy is a nervous condition characterized by rigidity. And catalepsy is not only used as a phenomenon and as a result of hypnosis, it can be used as an induction technique. And the good thing is when the catalepsy is induced, the subject cannot feel pain. That's the good thing about catalepsy. So if you are able to induce catalepsy in a patient, then he or she cannot feel pain. Post-hypnotic suggestions, which are widely used when it comes to operative hypnodontics, because in operative hypnodontics, you don't have communication with the patient sometimes. So you have to hypnotize the patient in advance and use the appropriate suggestions to control the bleeding, and then the post-hypnotic suggestions work during the process. Time distortion is one of the most interesting things when it comes to hypnosis. The time perception can be longer or shorter than the actual time based on the client's experience. A 2-hour session can be realized as 10 minutes easily. Idiomotor responses, which are really interesting because sometimes the hypnosis becomes really deep and you lose the communication channel with your patient. So you need to communicate with the subject, and idiomotor responses are very useful in these circumstances. The thing is, a deep hypnosis is not needed in a therapeutic approach. So just an average hypnosis level is enough to do the therapeutic approach. Age regression, these phenomena can be used as a therapeutic approach sometimes. Babinski reflex. You know, Babinski reflex is gone after the infant reaches the age of 8 months. So after the age of 8 months, a positive Babinski reflex is a poor sign of an upper motor neuron disease. When I used to practice medicine, I remember a Babinski positive test was diagnosed brain tumor. So a positive Babinski test is a serious sign when it comes to upper motor neuron diseases. But in hypnosis, you can see a positive Babinski reflex quite occasion. Age progression, which is a real interesting tool when it comes to psychotherapy, which is based on hypnosis, anesthesia, analgesia. Amnesia and pseudo-memories. Pseudo-memories are kind of side effects of hypnosis, but the thing is they are not permanent, they are temporary, and they are not important. But if you don't approach the patient um, appropriately, you may induce some memories which does not exist. Positive and negative hallucinations, which are common in hypnosis. Positive and negative hallucinations are quite common in hypnosis. Positive hallucination is seeing something which does not exist, and negative hallucination is not seeing or missing something which really exists. Somnambulism is one of the deepest experiences in hypnosis. In therapeutic approaches, you don't need these depth of hypnosis, but sometimes it happens. And depersonalization is one of the most common phenomena in somnambulism. So the subject cannot differentiate himself and understand himself or herself as a separate entity. And most of them experience a kind of unity experience with the universe. And out-of-body experience is another phenomena in deep hypnosis. And I just want to introduce to you some important associations all around and foundations all around the world when it comes to clinical hypnosis. American Society of Clinical Hypnosis, which is the leader and the best, and North Carolina Society of Clinical Hypnosis is another society. Iranian Scientific Society of Clinical Hypnosis is really strong when it comes to clinical hypnosis, and the International Society of Hypnosis. I used to be a member of the International Society of Hypnosis and the Iranian Scientific Society of Clinical Hypnosis. The Milton Erickson Foundation is very strong when it comes to conversational hypnosis and Ericksonian style of hypnosis. Thank you so much for your attention and have a beautiful day. Bye for now.